Today we're going to discuss what is pain, what does it look like, and why they prescribe medications like Rimadyl or meloxicam and gabapentin. Is pain? So basically, it's a protective device that alerts the body that something might be dangerous or that there might be a problem. Chronic pain is when the spinal cord or this dorsal horn gets overwhelmed with information. So basically, with a dog with arthritis in its hip, for example, the pain is coming up and it's going to the brain, and then the brain is saying, oh my gosh, we've got a lot of input here. I don't know what to do with this. Another type of pain is called neuropathic pain, and it's very common in our senior dogs. It isn't typically triggered by any single event or injury. Instead, the body just keeps sending pain signals unprompted, and neuropathic pain tends to get worse over time. Now let's talk about what the signs of pain are in your dog. So if your dog is vocalizing, in my world, that's a 10 out of a 10. And that means your dog is in a lot of pain and you need to go to your veterinarian. But some of the more subtle signs of pain include things like panting a lot, and generally it's in the evenings, not in the mornings. Maybe they go to lie down and they circle around, lie down, then get up again and move, and they just can't seem to get quite comfortable. Also, you'll see a decrease in activity, or your dog may seem a little bit more aggressive isn't the right word, but just doesn't want you or maybe other dogs near him. And his posture may change a little bit. It'll be maybe a little bit more hunched over or guarded. And going back to neuropathic pain, one of the signs of neuropathic pain is when you have a dog that is, you may see in their carpal joint is where I see it the most, and they may be licking, and you've gone to the vet and they can't find anything wrong with that. And what's happening is with that neuropathic pain is the nerves are sending a message from the brain down, and it might be a tingling feeling or numbness. It's hard to tell because our dogs can't tell us. Treating pain. There's many different ways to treat pain in your dog. I typically recommend people use both conventional and alternative methods. So the conventional route is something like Metacam or Rimadyl or a whole host of other non-steroidal anti-inflammatories. But basically what they're doing is reducing the inflammation which is causing the pain in a certain area, i.e. maybe the dog's hip or knee. So to increase pain control, they will add a drug like gabapentin. Because gabapentin, which is an anti-seizure drug in humans, actually settles down all those signals that are coming from the brain and telling your whole entire body that it's hurting. And so they'll use that in combination with the non-steroidal anti-inflammatory. And then other adjuncts that you can add to it are natural herbs like curcumin or devil's claw, or even cannabis for your pet can be very beneficial. When it comes to cannabis, I'm a veterinary cannabis counselor, there is one warning that you should be aware of. It does interact with certain medications, gabapentin being one of them, and also it does get processed through the liver, so it in fact can increase some liver values. But I highly recommend it if you're working with a professional that knows what to use and when to use it.